There are a number of reasons you may be needing to give medication orally to your chicken. Of course, for an entire flock, there are common drugs that we use to treat everyone through the food or water. Do jump over to our video on how to dose through the water if that's what you're looking for. But often you'll have just one bird in the group that needs medicating, or sometimes your vet may recommend treating individuals by Beak if there's a concern that they may not get their full dose through the water. For example, if a bird is already feeling unwell and off her food and water, of course she's not going to take in her full dose of medication if it's through the food or water. Dosing by Beak is a great way of making sure the individual is getting their intended exact dose. So, whether you're giving dewormers or medicating a sick chook with antibiotics, pain relief, or even anti-nausea medication, we will break down how to do so safely here. It all comes down to restraint to control the mouth. So let's break that down. Ideally, you'd have a second person to help with holding the bird, but otherwise what you do is sit the bird on your lap and apply pressure over the back, over both wings to keep her in one spot. Laying a towel over her back and gently wrapping to help contain her can be really helpful for her as well. It does add a little element of sedation there just to keep her calm. Now, I personally am right-handed, so I have her facing my right hand because I'm going to be restraining her head with my left and giving the medication with my right. Now, this is the part that people find tricky sometimes. You're going to use the palm of your hand and place that on the back of her head, and then use your thumb and forefinger or middle finger on either side of the base of her beak. Just a small amount of pressure here just to hold her still. She will resist with her head for a moment usually, so just hold gently until she relaxes. It should only last a couple of seconds. Once she relaxes, open her beak and just keep that thumb and forefinger in the corners of her mouth. A little pressure from those fingers is what's going to keep her mouth open for you. Now, for the medication, let's start with tablets because they're quick and super easy. Chickens do not tend to spit them back at you and bite like cats and dogs do. All you do is drop it down the back of the throat and they will swallow it. Do follow the vet's instructions. Some drugs need to be chased with a little bit of water so they don't irritate the throat and lining of the crop. So just follow the vet's advice on the drug that you're using. Let's move on to giving fluid medications. This one is a little trickier and a little more risky if done incorrectly. Let's have a look at the back of the throat here in a chicken so you can appreciate the risk and what I'm talking about. This is the larynx at the back of the throat. Now, of course, we have two holes back here. One is the opening to the trachea, the windpipe, and of course we do not want liquid to go accidentally down this hole. If they accidentally inhale liquid into the trachea when they're breathing with the glottis open, then they may suffocate from the fluid in the lungs. Or, even if that suffocation's not immediate, the medication can cause irritation and lung damage over a longer period of time. Where we do want the fluid to go is down this hole, the esophagus, the food pipe. And you can access that food pipe on either side of the larynx that leads to the opening of the esophagus. Now, keep in mind that if drugs are intended for the drinking water, if that's what they're labelled for, then that means there's likely no safety data on giving it directly by mouth. So what I usually recommend here is diluting it with water in this situation as well, just to make sure there's no irritation going on when it sits in that crop. So say you have a 0.1 ml dose that she's meant to receive, just fill the rest of the 1 ml syringe with water as well. So there are two ways that we can actually give this liquid, depending on your confidence level and the stress levels of the bird. Firstly, I should say that even with liquid medication, another alternative altogether is to soak a little piece of food, usually bread, with the liquid and pop it in the back of the throat, like you would for a tablet. If it's a small enough volume, this can actually work quite well. Otherwise, if you're dosing liquid directly into the beak, you can use a small 1 ml syringe, which to be fair is usually what we're using in birds anyway, and place it to the side of the larynx and down. You don't want to go far past it. In fact, if you're using a rigid syringe like this, you don't want to cram it right down the throat because you can bruise and scrape that little esophagus. A vet using a long, gentle crop tube is a different story, but with a hard syringe, just past that opening to the airway is fine. That's where we're trying to get, just to bypass the opening to the windpipe, so there's no chance it's going to go into the lungs. I will guide the syringe to the side of the larynx closest to me so I can visualize where it's sitting. Can you see here? With a little gentle pressure, I can actually see how far back the tip of that syringe is sitting. And there we go, all at once. The alternative, if you don't feel comfortable doing this, is dropping just a little bit in the front of the beak and letting her swallow. The downside to this method is that if she is stressed or literally in respiratory distress and is open mouth breathing, then that airway is going to be persistently open because she's prioritizing her breathing, and she's much more likely to breathe that liquid in, putting her in worse respiratory distress. The irony. The other downside is that it takes longer. You're literally dripping it in very small amounts, and you don't want to give a large volume all at once. So have a think and a practice. I can tell you that it quickly gets a lot easier with practice for both you and the chook. The most difficult part is the handling, containing the wings, stabilizing the head. Make sure you have good control of her head so you can see what you're doing. All right, good luck guys, you'll be fine. Bye-bye.